been a quite busy morning. There's not many of us on today, so we're quite busy. Right.
They are in crisis mode here.
Can I take your temperature, my love?
There's too much to do and not enough hours in the day to do it.
OK, love. I'll be back in a sec.
The floor of this care home is now full of NHS patients.
Every time you get a discharge, you'll always get another patient coming after. So it's a quick turnaround at the moment.
So you can feel that pressure from the NHS?
Oh, yeah.
Bearing down on you?
Definitely, yes. Yeah.
This care home is trying its best to hold back the new surge in this crippling pandemic.
In 1 week, you know, I'd had a shift on the weekend. It was completely fine, you know, everything was going well. The next week I come back, every single name on the board had a little sticker next to it saying they had COVID, and I literally was terrified. It'll be lunchtime soon, so you want to be sat up, don't you, for lunch?
Eva's a third-year medical student working part-time as a carer here.
Look at the board. We're absolutely full. Luckily, no one's got COVID at the moment, but who knows what's going to happen in the next few weeks.
And that's the thing. Pressure on health and social care is rising. Demand for beds higher than it's ever been.
Care homes like this one have never been busier. And that's because more patients are arriving here from hospitals that are bursting at the seams. This is what the third wave of this pandemic looks like. And if the NHS is overwhelmed, then the same will happen here.
Nationally, there's evidence that care homes are struggling to staff places like this. A survey by the National Care Forum found that care homes were operating at absence rates of up to 50% in some cases.
I think this is the experience that you're seeing and the experience we're hearing from members is a really important early warning flag that we must pay absolute attention to. We want to ensure that those care homes are available and those community services are available for people coming out of hospital. But unless they have the staffing to do that, of course they can't do that in the way that they want to or in the way that any of us would expect them
to. It's just like what I would class as Groundhog Day. You just expect the same thing every day.
One person gets discharged, another one
comes in. Yeah.
Day after day.
Yeah. I get asked plenty of times, because we do swabbing as well for our staff, when's this going to end? When's this going to end? And you can't answer it. I'd love to say tomorrow or next week, but can't answer that one. So we just keep going.
They have fought this virus for months now, and they're tired and worn out. But in the face of all of that, the care continues. Nick Martin, Sky News, Sheffield.